Hello, I'm Sanjeev Sabharwal. I'm the director of UCSF Pediatric Orthopaedic Fellowship here at Benioff Children's Hospital, both sides of the bay in Northern California. Due to institutional policies, we are unable to meet you in person, but I hope that this video will help you learn a little bit about our Pediatric Orthopaedic Fellowship here at UCSF. So enjoy. It's just amazing that one-to-one connection, the humanism that just is reflected in our dealings with patients and staff.
I really feel, especially the community we get to serve, I learn from them every day, and I'm humbled and grateful for the privilege to take care of these patients in a community that's in need.
For years, as the Bay Area pediatric orthopedic scene kind of changed a little bit, and we have these two hospitals, and we had more attendings, we felt like this is really the time for us. We have the resources and case volume to teach someone who's going to be going on to that career. We've had a very well-established program for the residents, but we just didn't have that fellowship. And then Dr. Sabharwal came on our faculty several years ago, very well-known in limb deformity, and said, hey, I want to develop this fellowship. You want to teach the next generation.
Pediatric Orthopaedic Fellowship is really about identifying what you really want to do in your career. You've gotten through orthopedic residency, you've gotten to understand that pediatric orthopedics is something that you want to do. But I really think that the fellowship year is designed to take the big picture and fine-tune it a little bit.
The Pediatric Orthopedic Fellowship curriculum is really designed to be an adult learning model. We have a core set of rotations that we do want the fellow to do throughout their year with us. But we also have ample amount of time for electives and for some subspecialty development of their choosing.
The fellow will be doing cases, doing clinics, and participating in more research activities based on what he or she is more interested in clinically.
We have major trauma hospitals, so if you need to get more time getting in trauma, you can be in the fracture room. If you need more time in a scoliosis case, there's plenty of scoliosis cases that you have. So there's some flexibility built in, but there's some guardrails to make sure that you get everything else set up too.
We offer training in all subspecialties in pediatric orthopedics, so regardless of whether they want to do spine or focus on general pediatrics or sports medicine, we have providers here who specialize in those areas.
Here we have an outstanding spine service, and I work very closely with them. I help them, they help me. It's very, very easy. It's a natural, supportive relationship.
We collaborate on cases from idiopathic scoliosis to congenital scoliosis and everything in between.
There isn't anything that we won't do, from the standard to the exotic.
This is a relatively high volume for spine, and somewhere that if you are interested in including spine into your practice, you'll leave proficient.
You'll be able to finish a year's fellowship here and feel confident doing most spine work.
In terms of structure, we try to have our fellow be as hands-on as possible. This is really a year for them to further hone their clinical skills, their reasoning skills, their technical skills, and we really want the fellow to be hands-on. And so for that reason, they oftentimes will be working alongside an attending, sometimes leading residents through trauma cases, and also working in clinic, sometimes independently, but adjacent to an attending, so that they can develop the skills that are needed to make those clinical decisions, both in the clinic as well as in the operating room.
We have a tremendous faculty who all are world-renowned in terms of what they do. They want to teach, they want to impart their knowledge.
Great partners, both surgeons, non-operative physicians, nursing staff, physical therapy staff, clinic staff, from the x-ray techs to the security guards, the guys that mop the floor. Just everybody has a smile on their face and is happy to be here.
This is a unique opportunity where there's two different primary campuses. We have two legitimate and full pediatric hospitals. The Mission Bay Hospital, it's more of a directed academic feel because you do have every other residency represented there. Here in Oakland, it's more of a community feel. It's a major trauma hospital, so there's a lot more of a dedicated children's hospital feel. Additionally, we also have our Walnut Creek campus, which is a more ambulatory surgery center and a subspecialty clinic. And so I think you really get to see a lot of different things out of this fellowship.
Things that make us stand out. One is the diversity, and not just as a term that's thrown out, but in the true sense, we really live the diversity, be it the clinical pathology that we see at our various clinical sites. The patient population comes from all over the globe. Our practice settings are not just here local in Northern California, but some of us travel to other countries, especially low and middle income countries, and spend some time there for clinical teaching and research.
The Pediatric Orthopedic Fellow will have an opportunity to join me in my work in East Africa, as well as joining in on the work of UCSF's Department of Orthopedic Surgery, Institute of Global Orthopedics and Traumatology. And so we welcome fellows who are interested in global surgery work and advancing capacity building efforts in low and middle income countries as a collaborative partner.
We encourage our trainees to go on conferences, especially POSNA and other subspecialty conferences as well throughout their year here, so that they're not only learning from us internally, but also we want them to be tied in with the greater community.
The Bay Area is one of the greatest places to live in the world. Never too hot, never too cold. We have hiking trails less than 10-minute drive away in the Oakland Hills. Further afield in the Sierra Nevadas, there's skiing and rock climbing. Napa wine country, there's every activity you could want to do, and we do give you a little time to do that. You're not in the hospital the whole fellowship.
So during the core rotations, we try to have the fellow paired with 2 or 3 attendings that are within that subspecialty area. So that really kind of allows the fellow to develop this mentorship type of experience with a couple of the attendings. And by the end of the year, or halfway through the year, they've had that experience with all of the attendings. And therefore, in the second half of the fellowship, they can nurture those relationships even more with the attendings that are in those subspecialty areas. At the end of the day, once you leave fellowship here at UCSF, we want you to feel supported no matter where you are in practice. And developing those mentorship relationships are going to be so essential to having that support that you need early on in practice.
They can always call us back and we'll be happy to discuss things. They become our family.
You basically have parents, I like to say, or relatives who will always be with you in your practice. So great people who are dedicated to teaching, who are always going to support you, and you're going to get great knowledge from them. So I think that's the biggest part of our program.
These days, medicine has become like so cookbookish. Everything's an algorithm. It's all about AI and numbers and data sets, etc. But somewhere out there, I think the human element gets lost. For a trainee or a fellow, that's the one thing we can guarantee, is that human element, which is so important and really is the backbone of medicine. In our program, that sort of culture of humanism is still there.